So yes, definitely. When we came into sort of 2020, there was a lot of talk about, concerns about sort of equity valuations at that point, even before we'd even heard about COVID. But we were very keen on the underlying structural demand trend within technologies and healthcare as well. And as COVID unraveled, this only increased our conviction to these sectors, because that demand for new technologies, that collision between the physical and the digital industries will only continue. And we've seen this in consumer behavior and actual way businesses are behaving today.
Bill, when it comes to healthcare, it's been a very wide conversation where the view is that you'll see more healthcare spending after a lot of underspending in recent years, because COVID-19 has highlighted the case that governments need to spend more. The other big component that you've got spending on treatments and vaccines for coronavirus. Is there anything more specific in terms of playing the sector than those arguments I've just put forward?
Yeah, no, absolutely. I think the arguments you've put forward are very valid, and I think the arguments that just increase the sort of acceleration or the momentum behind this sector. Prior to the sort of COVID story, there was a very strong structural trend behind healthcare regardless. And this came out of sort of access to healthcare globally, we're talking about here, was much greater. Aging demographics, the need for healthcare through a much aging population, the take-up of broader healthcare within the emerging markets, especially the Asian countries, was providing structural stimulus to the sector as well. So there's a bigger underlying structural story. And the COVID, and we'll talk about therapeutics and vaccinations, was just an extra stimulus to this sector.